the way I think of the world, I have a biased lens as being a biomedical engineer that cares about the equipment.
Mhm.
What I was ingrained, or what was ingrained into me, especially while I was working at the health systems, was how important medical equipment is just to the equation of healthcare. And if you think about healthcare, it's really a combination of a patient, a provider, and an instrument. Like
Mhm.
it's hard to remember the last time any of us got care without some kind of technology or equipment or instrument being involved.
Right.
Whether it's as small as a thermometer to take your temperature, that's
Mhm.
still a device. Whether it's a scale to take your weight, you probably have one in your home, still a
Mhm.
device. Or a vitals monitor, whatever it is. You're probably touching a machine every time you walk into a dentist office or a medical office or a vet or an optometry office. Doesn't
Mhm.
matter. So if you think about it that way, that's the equation. A lot of this either solutions or the way that we think about healthcare is always revolving around the provider and the patient, and we ignore the technology aspect a lot,
Mm.
especially when it comes to managing the care environments. So if we think about access to healthcare and we're moving care from these big hospital systems into your communities, into your homes, it's not just the patient and provider that have to make that same journey. It's also a device or an instrument too.
Mhm.
If you have nobody like me that really knows how to take care of that machine, that really understands the ins and outs of it, that we're now utilizing for diagnostic value, for life safety
Mhm.
value, all of these things, people know less about the machines the further you are away from a health system. And that's just because you don't have experts and it's too expensive and it doesn't make sense. It's very understandable why that happens.
Mhm.
But if I want to consume care in my community and in my home, I want to make sure that the equipment I'm using is always calibrated, up to date, and maintained.
Mhm.
And that I can't say is happening today without technologies like Uptime Health ensuring that it's happening. Because there's too much turnover in these outpatient and in home environments because people turn over a lot in these kinds of jobs.
Mhm.
But even if you had the institutional knowledge to know how to take care of these things, it's probably out the door in less than a year. And so, how do
Right.
you bring it back? You need systems and tools to just kind of automate the understandings, the learnings, and everything like that.
Mhm.
So the access problem is making sure the equipment is also great in those environments,
Mhm.
but it's also making sure people can service and repair in those environments. So this is the
Mhm.
other half of the problem.
Mhm.
There's not enough technicians today to support the number of medical instruments that there are in the world today, or even the US. Not even the world, just even the US is a good example.
Hmm.
So if we do have things break down, then we have to wait for a technician to come do the repair and get it back up and running. In the health system environment, you have technicians that live in the basements, that work in the hospitals, that can go floor to floor and take care of things within a pretty reasonable amount of time.
Right.
And if something does break, they can go to the basement, grab their part, go back up to floor 7 and fix it. And that's
Yeah.
kind of the journey. In the outpatient setting, the density of devices, which might be 10,000 per building in the health system world, is now 10,000 across 1,000 locations in the outpatient world. And so you have a logistical burden now that you're putting an already undersourced labor force through. So
Yep.
they have to now drive, they have to go through traffic, they have to check in, check out, grab gas. There's a lot
Mhm.
of things that make this an inefficient way to take care of equipment. And because people know less about it in those worlds, it breaks more often. So there are more emergent repairs demanding these technicians that now have to do,
Mhm.
maybe one repair per building instead of 100 in the old scenario. So
Right.
there's a lot of these things that we just need people to understand how to better take care of their equipment in those environments, to make sure things aren't broken, to make sure people don't have to come out and fix it, or else you, I, and everybody else will be waiting 1, 2, 3 weeks in the future
Mhm.
to get our life safety or our medical equipment back up and running. And that actually creates more of a healthcare crisis than an access solution because we're more reliant on the world that we've built,
Mhm.
which might actually crumble if we don't service it correctly.